Today I am doing Agnes for under eye bags. So Agnes is microneedling with radio frequency, and what the radio frequency does is it sizzles that eye bag away, so you don't have to do a lower bleph. So this is a great treatment, especially if you don't want downtime of a couple weeks, post-op if you're doing lower eyelid surgery. So I have already done some numbing for our patient, and I am going to go ahead and start. I'm going to just push here. And you can see how her eye bag comes out, and we're going to go right in here. 1, 2, 3, here we go. Ooh, can you hear that sizzle? You okay? Mm-hmm. So I like to enter on an angle and then tilt down, enter on the angle. You doing all right? Mm-hmm. Okay. Mm-hmm. Good. That is a good answer. Okay. Now we're going to go back over medial. It's good news when it sizzles. Mm-hmm. You want to make sure you get the needle all the way to the shoulder. Sometimes you need a little extra. So you gotta get the skin all the way to the shoulder of that needle. Okay. Now I'm gonna pull down a little bit. We're gonna go one more row. Doing okay? Mm-hmm. And I usually recommend at least 2 treatments, but sometimes this can take up to 4. And a maximum of 40 pulses per side. We're going to do, I come back to the area that sizzled the most. Awesome. All right, cool. All right, and so now we're using a different needle. There we go. And this is an extra tightening step. This is a W3A needle. It's got 3 prongs on it. A lot quicker, shorter pulse width time, as you've noticed. There's no sizzle that needs to happen with this. This is just extra to help with wrinkles. So we all want extra tightening, don't we? I think we do. Easy peasy. You doing okay? Mm-hmm. Awesome. And then oftentimes I will combine this, not often, I always combine this Agnes with Scarlet afterwards. Because Scarlet's also microneedling with radio frequency, but it gives you more tightening, which is always helpful. But then we can also do the eyelids too, and it helps to prevent bleeding or bruising, because you get some more of that radio frequency. That heat will help to constrict, and it will help in case you're developing a bruise. So I love to and always do combine Scarlet with the Agnes. Okay, how you doing? You okay? Mm-hmm. Okay, great. So this is a W3A needle. You can see those little, they're so tiny, teeny tiny little 3 of them. There's a 3 prong. Love it. Okay, now we're going to do the other side. Okay, here we go. Beautiful. You know, it's a lot of pressure. Maybe I'll stop with the pressure. You know, it'd be kind of annoying. Are you having any pain?
Mm-mm.
And I typically have people come back in 3 months for their next Agnes. But I do like doing scarlets in between. So I'll have people do one Agnes with the scarlet, then I'll have them do scarlet, scarlet, and then come back and do their next Agnes with their 4th scarlet, then scarlet, scarlet. So there we go. So quick. So after this, I'm going to put little hydrocolloid bandages on our patient's eyes and have her leave them on until tomorrow, and they will come off on their own. And no, like, I would also get a new pillowcase for your pillow so it's nice and clean. Don't let the dogs or cats kiss you on your eyes. I don't know if you like to snuggle with them, but if you do, don't let them for the next couple days. Try to avoid putting your head in, like, don't go into a hot tub or go swimming, etc. because these are open channels for a little bit until they heal. But I mean, for all the poking that we did, you're really looking great.
Oh, good.
So we'll scoop to the scarlet next.